And Discovery Week number 2 has been happening at the Woodstock Hospital. We've got a couple of medical students in studio with us this morning. Let's say good morning to Karnig and Michael. Welcome to Heart FM, and thanks for joining us today.
Thank you very much for having us.
Yeah, thank you for having us.
Two of you both have PhDs already before coming into med school, right?
Correct.
Oh, wow.
For you, Karnig, what's your PhD?
So I did my PhD in ICU research, so using different kinds of machine learning models to see if we could predict which patients would wake up from a coma and go on and have a good outcome after having brain injuries.
Wow. That's pretty hardcore.
Wow.
I know.
My jaw's on the floor.
And what about for you, Mike?
Yeah, so my research was in prostate cancer, so basically trying to understand why patients are developing resistance to certain types of therapies that are being used to treat late-stage prostate cancer patients.
Okay, so just out of curiosity, how many years have you guys been in school now? Because you guys both have PhDs, and now you're in part of this, the Schulich School of Medicine, so...
A lot?
Yeah, I think this is year 10 for me.
Oh,
yeah,
my gosh.
Wow.
I do not want to know what your student debt is.
Both of you are fairly close to home, actually. I think, Karnig, you said you live right near Kitchener, and Michael, you're from London.
Correct.
And
Nice.
you basically went to Western your whole post-secondary career.
Yes.
All right, good for you. What have you guys seen? Let's start with you, Karnig. What have you seen during Discovery Week thus far that's kind of blown you away a little bit?
Yeah, I mean, we've been so lucky to see such a range of different types of things with so many wonderful doctors. A couple things that stick out was being able to see some knee replacements, spending some time in the emergency room and seeing how fast and dynamic that is with so many different types of patient presentations. I think those are some of the main highlights for me.
And what about for you, Mike?
Yeah, just being in the hospital setting, trying out all the different rotations, such as, the operating room, emergency room, CCU. Been having some great experiences with the physicians as well. Got to see a vasectomy in real time, so that was interesting as well. So yeah, it's been a great time.
Yeah, I was going to say one thing really interesting about the Woodstock Hospital. I'm kind of circling back here to when you were talking about the knee replacement is we have the Corey surgical robot, so you got to see that in action.
Yes, definitely. It's so fascinating to see how these advancements in technology, have made their way into hospitals like Woodstock and how robot-assisted surgeries are doing wonders for patients.
And the technology advancement, too, because one of you had seen a bladder cancer removal as well. Much less invasive, I guess, than it might have been maybe 10 years ago, Mike?
Yeah. So I guess they're just kind of going through certain holes, not kind of opening up the entire body now.
Yeah.
So I would say it's definitely less invasive probably than it's been in the past.
But, be kind of a sort of a neat experience. And the hospital environment, is this different from your experiences in the past being at the Woodstock Hospital? How about for you?
Yeah, 100%. I mean, we do our training in London. There are massive academic hospitals. There's hundreds of medical students, hundreds of resident physicians, hundreds of doctors. And so what you get to see on a day-to-day basis is a little bit more limited. But when you're in a place like Woodstock, where it's just you and the physician, you get a lot more hands-on experience. The physicians here really take the time to explain things to you, make sure you feel comfortable, make sure you're learning something. And overall, the smaller environment here, but the wide breadth and the scope of procedures and types of physicians there are here is just really fascinating. It's just amazing being in a place that feels more community-based.
It's 8/12, Discovery Week at Woodstock Hospital. It's an opportunity for medical students to come and shadow over the doctors and surgeons that we have here in the friendly city. Michael, have you made a decision as to what type of medicine you're hoping to practice maybe when you're done with med school?
Yeah, so kind of just coming out of first year, I'm still kind of up in the air. I have some ideas of, thinking more kind of in the internal medicine side, potentially in kind of the endocrinology, so kind of working with hormones and diabetes.
Oh, wow.
Okay.
Potentially even oncology, because, that's related to more of my research,
right.
My PhD, but also be happy being a family physician as well. So just trying to figure that out at this point.
Yes, you're kind of fairly open right now.
Exactly.
You're just seeing where you end up kind of thing.
Exactly.
Direct family members, not necessarily involved in medicine. How did you get the itch?
Yeah, so I think in high school I kind of got my first taste of biology and kind of fell in love with that and learning about the human body. And then I think kind of during my research, I love research. I love learning about the human body and everything. I think the thing that I was really missing, though, is working and interacting with patients and, getting to work with them on a day-to-day basis and, helping them with their problems directly. So kind of being more on the front lines.
Getting stuck in research can be very...
like you're behind a desk kind of thing.
It's impersonal, right? You don't get to see the people and see the results of the work that you've done. And there's probably something, I would imagine, satisfying in seeing a good outcome.
100%.
Which is wonderful. And what about for you, Karnig? Do you have any idea what you might like to do in medicine once you graduate?
Yeah, honestly, it changes every week. It depends on what we're learning.
Exactly.
I think at the end of the day, just being in a position where you're in a position to help someone through maybe the toughest times of their lives, or just something very simple and straightforward. I think one thing I just wanted to add here is that the patients have been so welcoming of us as well. They've been so happy to see medical students here with the doctors, and they've oftentimes will say, yeah, do whatever you want or learn however you need to learn. And it's just things like that, I think, that just make us even more excited to be doctors. So wherever we end up, whatever type of physician we'll be, having, the great patients here have just made that experience so great for us.
So now that you guys have had that experience kind of working in the smaller rural hospital, is that like an environment you could see yourself working in the future once you guys are done with your schooling?
I think it's definitely given a positive experience. It's definitely something I'll consider more in the future for sure. It's definitely been a very positive and help.
Yeah, definitely for me as well. I think it's just so nice to be in a place where everybody knows each other, but the scope of medicine that is done here is still so broad, and that overall community and warm feeling of a hospital like Woodstock is definitely left a really great impression.
Yeah, I think it's great to hear from students who have that behind the scenes look at it. We, the residents of Woodstock, get a good feeling hearing that that's the case, knowing that we're incredibly lucky to have the surgeons, the doctors, and that wonderful facility, which is only 14 years old. So we're incredibly lucky. Karnig and Michael, anything else you guys want to pass along to the audience about your experience either here during Discovery Week or anything else that we should know?
That I can think of.
Just thanks for welcoming us into your community for the past week. It really has been, I think, a highlight of a first year of medical school, and we're hoping to come back in the future.
Yeah, well, we hope to have you back as well. It's been great to meet the two of you, and thanks for coming in today and telling us about your experiences.
Thank you
for having us.
8:16.
McDonald's Summer Drink Days are back.